So first, for everyone who doesn't know, if you could go introduce yourself, that would be great.
Sure. My name is Dr. Deborah Pinels, and I'm the Medical Director for Behavioral Health and Forensic Programs for Michigan Department of Health and Human Services.
Perfect. So what is MDHHS recommending school districts do to keep their students and faculty safe this upcoming school year? Let's kind of start there.
Yeah, we are looking at the COVID rates and trying to follow the public health guidelines and the CDC guidelines to help ensure maximum safety. And so that includes mask wearing and for kids that are old enough, getting vaccinated, and of course, recommending for teachers and adults getting vaccinated as well.
Yeah, and then specifically teens, because since they know a lot probably about COVID more, seeing like the news and being able to understand it more, what types of concerns might some teens have about going back in person this upcoming school year?
Yeah, I think that there's a lot of anxiety just generally. We would love to have the entire COVID-19 in the rearview mirror, but it's obviously not in the rearview mirror yet. And so there's lots of questions. We've got the Delta variant that people are hearing about in the news that's raising other questions. And so really what we would recommend is that you try and stay close to the public health guidance. You try and stay close to what the CDC is saying in terms of that information. Try not to overwhelm yourself with too much media that can be scary. And really just recognize that we are trying to follow the science and follow the recommendations that are out there.
Yes, and specifically for teens, that they started the Stay Well virtual support groups. Can you talk about how that started and what that's going to look like?
Yeah, so we recognize that because of all the stress that's out there, that it's really important that we are paying attention to our mental health as much as we're paying attention to our physical health. And the Stay Well program is funded through a federal grant program that is meant to help communities or states, in this case, deal with disasters and acute events. And COVID-19 fit into that federal requirement when we declared the state of emergency related to COVID-19. And so as part of that, we've established these support groups, web-based support groups that are available for a whole variety of different people, including some support groups specifically focused on teens.
Yeah, and what can people expect when they attend these support groups, specifically teenagers that may not understand what it is?
Well, one is that we have a trained counselor that's available to facilitate the groups. It's not therapy per se. It's a way to just do active listening, help problem solve, help point people into resources. The other thing is because other teens from around the state are joining, they'll have peers that are also experiencing some of the same stressors, asking the same questions. And so sometimes having peers opening up and talking about their issues can help you feel more at ease because you're not the only one worrying about something. They're engaging them in also good activities, fun activities. We have a whole bunch of things going on. In addition to the teen support groups, we have a summer resilience series that engages people in really cool activities using creative arts and mindfulness and all sorts of ways to help people try and get grounded and pay attention to their mental health.
Yeah. As far as who can participate, I know you said the variety of ages. What is probably like the youngest age of a support group that this program offers?
You can go to the website to find specific information for the groups. We have the teenage group. We also, with parental consent, can have younger kids participate. We have, for example, a Draw Your Feelings summer resilience series for parents with their smaller children that could be appropriate for people. And so there's different things for different age groups. We also have an older adult support group as well.
And how often, how frequent do these groups meet? And do you have to commit to going to a certain amount, or can you just kind of pop into one?
You can commit to popping in whenever you want, and there's no requirement that you sign up and that you're obligated to be at every group. So people can pick and choose what fits for them. And I would encourage people to go to the staywell.gov website to see when they're scheduled for and the frequency and the times that they meet. And some of the things that we're offering do end up in not the support groups per se, but some of the other offerings in the Summer Resilience series have a recorded version so that if you can't make the live event, you can at least watch the content later at your convenience that will be on the website.
And see, I'm assuming people that have similar like concerns as you and just kind of a safe space. What are some signs that kids may be struggling at home with like anxiety leading up to the school year, but may not be talking about it that parents should look out for?
Well, more withdrawal, more irritability. So it's either the more outward expression or the more turning inward could be signs of concern. People changing their eating habits or their sleeping habits, people expressing hopelessness, doom and gloom, people expressing suicidal thoughts. Those are all things that parents or caretakers should be more concerned about. And again, they can call the Stay Well resources, the parents, and talk to them. There are ways to get connected to more help if that's necessary.
And how can parents facilitate a conversation about mental health with their students going into the school year?
I think it's really important. And I think the more and more with what people are experiencing from COVID-19, people are more open to talking about their mental health. And I think it's fine to say, hey, this is a stressful time. How are you doing? Checking in, trying to open up that dialogue, talking about the fact that it may be hard to talk, but letting them know too that if they don't want to talk to their parents, there's other resources. For example, we have a text line for kids for anyone really, but a lot of times kids like to text more than they like to talk. We have a text line that people can access. And then we have that talk line. If you call the Stay Well counselors at the COVID-19 hotline and press 8. And so what parents can say is they could try and open up that discussion, but then also say, hey, if you don't want to talk to me, I heard the state's offering these other supports and here's the number if you're ever interested.
Huh. And lastly, one more time for those resources, where can people go to find those about the Stay Well program or any of the creative art programs that you talked about?
It's all available if you Google michigan.gov/staywell. It's all right there on the website. There's just a host of video resources, brochures, information about the webinars, information about the Summer Resilience Series. And so michigan.gov/staywell.
Perfect. And then anything else that you want the community to know or you want people to know that may see this?
I just think that it's really important for people to remember that taking care of their mental health is just as important as their physical health, that we're all going through a really difficult experience. We've shown that we can get through it. We already have been through so much together, and we have to keep relying on each other to help each other and know that there's resources out there that the state and MDHHS is providing.
Thank you so much for joining us. I really appreciate it. I'm sure everyone watching this has learned something today.
Well, thank you so much for covering this important story.